So during this heart cath, the doctor asked me about pets. He asked me if I had pets. I said yes. He said you need to make arrangements for your pets, as you need to have an operation. So make arrangements for your pets and come back and get this operation. So I make arrangements for my dog. Tried to call his office over 100 times in a week to make an appointment for the surgery. Got absolutely nowhere. So in my mind, after that, I had it where I was just gonna go into the ER when I'm ready to for the operation. Tell the ER doctor, look, had the heart cath. They told me I needed an operation, and that's exactly what I did. I went into what used to be called Florida Hospital South. It's Advent Orlando now. I'd never go back into it again after my experience here. And the cardiologist that did the heart cath, I would never go to him either. His name is Dr. Matthias. Now I must say, everything is my opinion that I'm saying right here about this physician and or the hospital. My opinion, that doctor has the worst bed manners ever. That cardiologist. His name's Matthias, Dr. Matthias. I know he does Kissimmee, Florida, Orlando, Florida, Celebration, Florida. He's in a group of cardiologists, and I would never go to him again. Never. I make arrangements and go back into the go to the hospital ER. Tell them, look, I'm having chest pains. Told the ER doctor what's going on. He looked up the records, admitted me, put me on a regular floor, and the beds they had in this part of the floor, they are air mattresses, and they keep moving constantly. I could not sleep. It's 10 o'clock at night. I asked the nurse to stop it. Nurse fiddled around with the bed. About 2 o'clock in the morning, I asked the nurse, I said, stop it, unplug it, whatever. And I believe when the nurse messed with it before, it made it worse. But anyway, I could not sleep. Nurse unplugged it. During the little bit of sleep I got, the bed went flat. Wake up 5 o'clock in the morning. I'm hurting like anything. My back's hurting. I already have a bad back. Asked him to get me another bed with a regular mattress. It took until almost 6 p.m. for that to happen. I was livid. At this time, I was ready to walk out and go to the other hospital, but they had me on a heparin drip, and that's the only thing keeping me alive at this point. That's how bad I was. So later on, a day or two later, this cardiologist, and this is why you understand why I don't care for him, comes in to see me. He don't want to answer any of my questions, and I'm nervous about this operation as anybody would be, and want to ask him questions. Don't want to answer anything. He just wants to come in for a minute, say hello, and leave, and bill you whatever he wants to. I don't know, but that's, again, this is all my opinion. So he comes in, sees me for a minute, and leaves. Don't want to answer my questions. I hear him right outside my door. He's waiting around. The chest surgeon's walking up the hallway, so he's waiting to talk to the chest surgeon, which is fine. Except, talks to the chest surgeon about me. Make yourself comfortable in that chair in there. Luckily, they have a chair. In other words, I'm going to ask him all kinds of questions and all this stuff he's telling the chest surgeon, which makes a bad report before the chest surgeon even comes into the room. No, I'm definitely not happy. There was a nurse in the room. After the chest surgeon left, I'm very upset about what this cardiologist said to the chest surgeon about me. I asked the nurse to get the supervisor. The nurse made a report about what was said from what I was told. I'm just going by what I was told, what the house nurse told me. The house nurse told me that she knew about it. She talked to the doctor and told the doctor this is not appropriate behavior in the hospital. Whether any of this is true or not, I don't know. I just know this doctor said a bunch of crap about me. In my opinion, I would never give him the time of day. In fact, if I'd see him out in the street, I'd probably punch him in the nose. I have nothing useful, nothing good to say about this doctor. His name's Dr. Matthias. So anyway, I do get the operation with the chest surgeon. Turns out the chest surgeon's okay, or seemed to be. I have complications right now. I believe I have complications, which I'll get into in part 3 or part 4. Anyway, I have the operation at this hospital, this Advent Orlando, which is supposed to be the premier heart hospital in Florida. It used to be called Florida Hospital South. Here, the intensive care room after my operation has a glass sliding door. It's like an observation room. Glass sliding door with a curtain. Except the room I was in, the door don't close. It don't slide. They couldn't get it to slide. Nobody called to get it fixed. Nobody fixed it while I was there. I don't know. I just know it wouldn't close. There was no dignity, no privacy for me whatsoever in this room. I was very upset. I'm only in this room for a day and a half, thankfully. Put me up in another regular room, hospital room. The toilet seat in this room, I can slide this thing at least 5 inches either direction. Ask the nurse to get it fixed. Next shift comes on. Ask the nurse to get it fixed. Still not fixed. Third 12-hour shift comes on. Ask the nurse to get it fixed. Half that shift goes by. It's still not fixed. Got on the phone. Asked the operator. I said, I would need to talk to the hospital administration. A nurse comes. I guess the charge nurse or something comes in my room 2 minutes later. So look, that toilet seat's loose. I asked 3 shifts now. It's almost 2 days ago to get it fixed. It's still not fixed. I'm not one to sue anybody, but I'm telling you now, if I get hurt because of that toilet seat, I'm suing. That should have been fixed a long time ago. It just didn't get loose right when I come in the room. It was loose for a long time and never fixed. That's pitiful, this hospital. So between their mattress, now the nurse not knowing how to operate the air mattress, that goes to training. Then the sliding glass door in the intensive care unit after my heart operation, after the bypass. That not working. There's no dignity. Everything hanging out. Everything showing for everybody walking by. And my guest company that I had. I'm very upset. Very sad. And then the toilet seat. There's no way I go up in hospital south. There's lack of training, lack of maintenance. Lots of maintenance needs to be done from my experience. And there's no way I'd go back in this hospital. I would go to ORMC, Orlando Medical Center, whatever it's called, a couple miles away. Not at the hospital next to Rollins College. After my experience, no. And stay tuned for part 3.